new Ebola outbreak has once again raised concerns across Africa, bringing back memories of one of the world's deadliest infectious diseases. And as health authorities intensify surveillance and preparedness efforts, many Nigerians are asking very important questions, such as how serious is this outbreak? Could it spread beyond its current location? And how prepared is Nigeria to respond if the threat reaches our borders? So today we will separate facts from fear and discuss what every Nigerian needs to know about Ebola. We'll also discuss the current situation and our nation's level of preparedness. Welcome to Today on ACN, coming to you from ACNN TV. I am Promise Njoko Adibi, your anchor, and I am not alone. Co-anchoring with me are two great people, so I'll let them introduce themselves, starting from my very far left. Let me hear you talk to us, young lady.
My name is Chinedu Blessing. Good morning to you.
Good to have you on set, Chinedu.
Femi Ogundare. Good morning, viewers, and good morning, Princess.
Blessed are you. Blessed are you among women.
And good morning, Chinedu.
Well, viewers, remember you are part of this conversation. So, like I will always say, feel free to join this conversation by calling the number showing on your screen. And if you can't call, please send us your comment via any of our social media platforms also showing on your screen. It's always, always a delight to hear from you. Now, joining us is none other than Dr. Adeniyi Samuel Ojini, well, FNIM. He is a public health physician and sustainability expert, and he's also the head department of public health, Redeemers University, Ede, Osun State. It's good to have you join us this morning, Doctor. How is Osun State?
Well, thank you very much, Joku. Osun State is very fine. We're at peace, and God is helping us.
All right. Thank you for joining us. Doctor, let me start with you. Can you once again remind us, about this deadly disease called Ebola? And as you're doing that, can you also tell us what causes it, how it is transmitted, and possibly the symptoms? Sorry, I'm giving a back-to-back question. So please, I take it again. Tell us about this Ebola, exactly what it is, the causes of Ebola, how it is transmitted, and the symptoms.
Well, thank you very much, and thank you very much, listeners at home. The Ebola disease is a very fatal disease that occurs in human beings, and it has a case fatality of an average case fatality of 50%, and that means like half of the people that infected eventually invariably die if nothing is done. And even in very good cases, it has been found that the fatality is between 25% and 90%. So it makes it a very serious disease. Now, this disease is caused by a virus, and not just one virus species. It is caused by viruses of the ortho Ebola virus genus, and under the ortho Ebola virus genus, we have 6 different viruses that can cause the Ebola disease. But 3 of them are the ones that are known to have caused great epidemics in the last few years, since 1976. And one of them is the Ebola virus itself. The other one is the Sudan virus, and then the third one is it's a very difficult name. It's called Bundibugyo virus. That's the third strain. These species are very virulent, and then they are very dangerous when they come into human beings. Now it is actually transmitted from the fruit bat. The fruit bat actually is the reservoir of the Ebola virus. And then when these fruit bats are eaten by human beings, or the dead carcasses come in contact with human beings through their hands or through, body fluids, fluids of the infected animals get into human beings, they begin the process of infection. And usually between the time that the human beings contact the virus and the time it begins to show symptoms, that is the incubation period, we are between 2 days to 21 days. So once someone gets into contact with the virus, it can take between 2 days to 21 days before the person starts showing symptoms. And what are the symptoms that you see? The symptoms are just like the symptoms of malaria. You just start with having fever, there is body pains, you have malaria, general feeling of weakness, then you have, after that, you start having things like abdominal pain, then you have, vomiting, and then initially, people would think that it's just malaria, just like with other viral hemorrhagic fevers like yellow fever and what have you. But as it goes on, you would discover that there's abdominal pain, and then the patient is becoming prostrate, the person is losing fluid, and then once the central nervous system gets involved, the person becomes confused and disoriented, and all of these are the symptoms. So what do we do? The first thing to be able to manage the patient properly is an index of suspicion. You need to know, from the history of this patient, has this patient been in areas where there has been reported outbreaks of, this condition? Or is this patient, even when there's not been a reported outbreak, by the time you see the symptoms and you have a high index of suspicion, you are thinking, okay, where is this person coming from? Has this person, been in this area that's endemic for this condition? And then that raises your suspicion. Then after that, you do your test. And then there are testing for, Ebola viruses. You can carry out specific tests for you to identify this, there are PCR tests we do, there are ELISA tests that we do to show that this is truly an Ebola virus that is causing the symptoms that you are seeing, the symptoms of headache, fever, abdominal pain, vomiting, and what have you, and then immediately you see that there are also treatment that you can, institute for, Ebola virus itself. Remember, I said there are 3 strains. There's the Ebola, there's the Budinguyo, and then there is the Sudan. Now, the Sudan and the Budinguyo do not have specific treatment. Neither do they have specific vaccines. But for the Ebola, the initial we had in 2014, and those initially, occurred around 1976 and early period, we have, treatment for the Ebola virus. But for Sudan and Budinguyo, there are no specific treatment and there are no vaccines. And when we get to the current, epidemic, we'll talk about the differences and what we need to do. So these are the symptoms. The mode of transmission I've just told you is when human beings come into contact with, fluids, body fluids, and, parts of infected animals, either dead or, alive, or when they eat them. These are the ways that, or when human beings come into contact with body fluids from another infected human beings in the process of taking care of them, they also can get infected. So the way you protect yourself from them is to ensure that there's good hygiene, and then health workers will use personal protective equipment. And then, of course, there will be a widespread, community engagement to sensitize people and enlighten them about this disease, just like we are doing now. And then there are other measures that can be taken. But I think I've talked to you about the origin of, Ebola virus, the disease itself, the various species that cause it, how it is transmitted, and how it is diagnosed. Let's go on from there. Thank you.
All right, Doctor, thank you so much for that. May I ask quickly, it's been said that this current outbreak is different from previous ones in terms of the biological nature or formation of this new virus. I want to ask, please, can you elaborate on this? And does it make it more deadlier compared to the previous variant?
Yeah, thank you very much. The truth is that this strain that we are seeing now is the Budinguyo, strain, which is not even as deadly as the Ebola virus strain itself, but it's also, quite deadly because the fatality rate is also around 50%, but then it's not getting to the region of 90% like is the case with Ebola virus. So we can say this strain is, generally associated with even lower, even though they are still highly dangerous, but with lower mortality rate. It ranges from 25 to 50, whereas the previous one that we saw ranges from between 25 to 90%. So in terms of fatality, this is a better one. But the truth is that it is still, very dangerous. And as a result of that, it's not something that one should joke about. Yes, I told you the three strains. This strain is also very difficult now because for the Ebola strain, the Ebola virus strain of Ebola disease, we have vaccines, we have treatment, we have medications. Unfortunately, for this current strain, there has not been found any vaccine. They are still in the process of developing a vaccine, but then there has not been any tested, proven vaccine for the Bundibugyo, virus, which is the one that is causing the current epidemic. And then because of that, and because there's no specific medications to treat it, it is more dangerous. I mean, it's considered more dangerous because even though the fatality is less, but if there is no medication and there's no vaccines, then in terms of the population, risk, it carries a higher risk than, the previous one that we had. I think that's just the issue. That's the current dilemma that we have with the current epidemic and the strain that is causing it.
All right,
thank you, Doc. We discovered that this virus seems to be rampant in the Democratic Republic of Congo. If our record has it, that we have 16 outbreak of this particular virus. And so the question is, why is it just on the Republic of Congo? Why is this so much reoccurrence in that particular area? And what's the significance to Nigeria? What's the effect on Nigeria? Knowing that we have similarities in the geographical locations, and social cultural practices and other variables.
Yeah, thank you very much. The reason it is more rampant in the Democratic Republic of Congo is simply because that area has the rainforest. Rainforest is the natural ecological habitat of the fruit bats that is a reservoir of the Ebola virus. So when we're talking about, auto Ebola viruses, genus, and all of these species, the rainforest is the ecological habitat where these, fruit bats that are reservoirs of this virus live. In the fruit bat, it doesn't cause any problem. But the moment it gets into human beings, it brings an infection that is very fatal. So the geographical location of Democratic Republic of Congo, makes it vulnerable because that's where you have the reservoir. Not that it can have it frequently. Like you said, since the 60s, there are about 16 outbreaks of, Ebola disease. And that's just because that is where the reservoir is. Now, again, one of the things that makes the Democratic Republic of Congo vulnerable is that, in that area, there's been a lot of mining activities. There's gold mining activities. There are lots of people that move from the forest into, human communities. So there is rapid movement. Aside from having the natural reservoir, people go into the natural reservoir and they come out through their socioeconomic activities. They interact with other members of the community and they spread the virus amongst them. Of course, the people that are in the mining areas, in the forest, people who do farming and things like that, people who do hunting, they come in contact with these, fruit bats, either dead or alive. Sometimes the droppings from the fruit bat, sometimes the fluid from the dead carcasses of those fruit bats and things, come in contact with human beings, and then from there they pick this, and then they go into communities and they infect other people. So we have talked about the geographical location being vulnerable because it consists of rainforest, and the rainforest is a natural ecological habitat for the fruit bats that are the reservoirs of this, viruses that cause Ebola disease. Aside from that, we've talked about socioeconomic reasons, the mining activities, the hunting, and then the agriculture that goes on those places, and then the rapid movement between the people who are in those rural areas and those that are in the, urban areas that, causes the movement of the virus, particularly when people are infected and they bring it to society. Aside from that, there is political instability and regional conflict. And this also has made it impossible, or made it very difficult for the country to be able to address the issues because of the incessant conflict in the Democratic Republic of Congo, and then and then the political instability. And then aside from that, also, of course, they have very weak infrastructure, very weak infrastructure. In fact, even the center for research in Ebola and the hospitals where they take care of the patients are often attacked by militias, by people who are in armed conflict and things like that. So as a result of that, the weakened infrastructure, economical situation, the political instability, regional conflict, the natural habitats of the fruit bats, which are the reservoirs. All of these are the factors that make the Democratic Republic of Congo a vulnerable site for the Ebola diseases. Thank you.
Very much, Doctor. This is actually very enlightening. Very. But then we have some other major concerns. I just have to ask two in one question. First, you've talked about the Republic of Congo. I want to ask, how vulnerable is Nigeria to an imported Ebola case, considering international travels, considering our porous borders and our regional movement within Africa? That's one. Then, secondly, given the reduction in international health funding in some areas, does Nigeria currently have the capacity? Do we have the resources and the surveillance system needed to dictate and respond quickly to a possible Ebola case? These two questions, Doctor. Thank
you. Thank you very much. The truth be told, we have very porous borders, so people can easily, gain access to our country without being detected. That is very true. However, people who are coming in through, officially recognized ways, and people who are flying into the country, and people who are coming through, land, borders, aside from those who are walking through footpaths in the bush and things like that, they are at the moment, being checked. I think the surveillance system also of our country, we talked about weak infrastructural systems for Democratic of Congo. We are in a similar situation. We must say the truth. We also have some level of conflict going on. We have the banditry, we have, the Boko Haram insurgencies, we have, community clashes, with instability, we have political instability. Our social systems are not very strong. Our surveillance system isn't so strong. Even though at the last time we did very well, with Ebola, because we thank God for Dr. Adeniyi, who quickly identified the, index case. And then from there, she raised an alarm, even though she paid the supreme sacrifice. But then, it helps us. It really helped Nigeria to be able to curb, Ebola virus when it came the last time. Now, this time around, how strong is our system? Of course, we ought to have gone better. The Nigerian surveillance system is supposed to have gone better. But I know that the Nigeria Center for Disease Control and Prevention, the NCDC, is, doing quite a lot. And then, in fact, it has already placed, a high alert status for Ebola importation. And some of the states in Nigeria already have been flagged. They have been flagged not because the virus is already there, but then NCDC has, given some advisory regarding some of those states. And then they classified them as, high-risk states and moderate-risk states. And those states include, of course, Lagos, the Federal Capital Territory, Rivers State, Kano, Enugu, Borno State, Akwa Ibom, Adamawa, Taraba, Cross River. These are states where, they have very porous both land and sea borders that, people can easily come in. But then the NCDC also has taken some steps. And some of those steps include, the active border screening protocols. The Nigerian Center for Disease Control, has put in place some measures to ensure that there is, screening at the borders. And then, and wherever there is any one that is coming in, whether the sea, the land, or at the airport, they ensure that they do a 21-day travel history, mapping to ensure that, okay, if you are coming in, where have you been in the last 21 days? Because I told you that the incubation period is between 2 and 21 days. So we want to know, even if you are not showing the symptoms, you don't have headache, you don't have fever and things, but then you might be carrying the infection, the virus. So the important thing is they are put in place this, travel history mapping, so that when you are coming in, they are checking from your passport, where have you been to in the last 21 days? Are you likely to have touched some of these areas where you are carrying this? And then aside from that, of course, they are also doing mandatory symptom screening. They are screening everyone that is coming in, for symptoms mandatory. What are those symptoms screening? The kind of gun they used to put, in your head, before your head those days to test your temperature. Yeah. So they are doing that. They're screening for temperature. They're asking for symptoms, aside from that, are you feeling weak and things like that. So all of that is going on. And then there is heightened, border surveillance. And, there are also restrictions. They are considering restrictions, to flight from those very, highly prone areas. So these are some of the measures that Nigerian government is putting in place, particularly through the NCDC, to ensure that we are safeguarded in Nigeria, that we don't have anybody import this to our country. Having said that, though, the issue of, international donor funding and, support from, of course, we know that it will get to this stage. Donors are becoming fatigued because they have their own problems. And so it is high time Nigeria begins to address its own problem. Now, I retired from the civil service as the Executive Secretary of Health Insurance. And then, if you look at our National Health Act 2014, in National Health Act 2014, there's establishment of Basic Healthcare Provision Fund. The Basic Healthcare Provision Fund actually has a part of it given to the Nigerian Center for Disease Control, the NCDC, for the purpose of surveillance, for emergency preparedness and other things. So I think what we need to do is ensure that money that is put into this, for this purpose, goes into the purpose, so that we don't, allow business as usual, so that Nigerian money can go into protecting Nigerians, particularly through the activities of the NCDC. Thank you.
All right, thank you, Doc. I want to quickly ask, because of paucity of time this morning, what are the methods of preventing this infectious disease? And what practical steps should ordinary Nigerians take in terms of hygiene, contact precautions, and health-seeking behaviors? And doctor, please, can you please combine this together as you answer the first question? So there are often a lot of misinformation during disease outbreaks. What are some common myths about Ebola that Nigerians should ignore?
Well, the first and foremost is that, they talk about I think they talk about bushmeat, that if you eat bushmeat, you are likely going to have, the virus. The truth is that in as much as we know that the fruit bats from rainforest are the natural habitat, we also, as a sustainability expert, I do not, encourage the, eating of, animals that are supposed to, form the ecological, diversity in our, in our forest or in our, in our ecosystem. So I do not encourage that. Even though, yes, it is not as if for everybody that eats, bushmeat, you are going to catch Ebola virus. No, the Ebola virus, it has entered into the country. It has entered into the country. The measures that needs to be taken, number one, is community engagement, like we're doing, sensitization. Now, number two, personal hygiene, hand washing, ensuring that you do not, touch any surface and then put your hand, having touched those surfaces into your mouth. If you wash your hand properly, you ensure that if you have come into contact with anyone that has symptoms, of fever, diarrhea, abdominal pain and things like that, that can be akin to, the Ebola disease, what you need to do is ensure that you do not, touch the materials, which we call them fomites, that have been used by this person. If you touch them, ensure that you wear your gloves, and particularly for healthcare workers. And then if you are not a healthcare worker, you're at home and you are doing this, ensure that anytime you are caring for someone who has such a disease or with such a symptom, whether it is confirmed or not, you ensure that you wash your hand properly. Once you engage in, proper personal hygiene, and then you also ensure that there's communities, environmental cleanliness. There is no, littering of the environment with, feces, with body fluids, urine, and things like that from, people that might be infected. You ensure a clean environment. And then for those who are working in the hospitals, for them to use the normal personal protective equipment, which will protect them from coming in contact with needle pricks or with, body fluids from people who they are treating in the hospitals, whether they are confirmed as Ebola disease cases or not. If we take these measures as individuals and as institutions and as communities, we are most likely going to be safe from, contacting the virus, which is, causing the disease. These are some of the measures that we need to take.
Thank you.
I don't know. I think there's one other question you want me to answer. I can't remember that now.
I have this particular question. When you talk about the church preaches love and faith. But then we find out that in science, it seems as if they have two different perspectives. And so from the perspective as a public health officer, what role do our leaders in the church play in supporting accurate health messaging and reducing the panic, and then without abandoning the issue of faith and compassion in their sermons? And then we also have this issue where, the first time we had Ebola, the church came in and they did a lot of campaign. And so the question is, should the church go back, or should we also join in reinstituting these preventive measures, or is it just a panic measures at this point?
No, it is not a panic measure. The truth is that the church is an institution that is not only supposed to take care of the spirituality of, their congregants, they're also supposed to take care of, community health. They're supposed to take care of, environmental health. The church is supposed to be, an advocate of health education. The church is supposed to, educate not only the congregation, but also members of the community. This is part of what we call, the corporate social responsibility of the church. So it is not out of panic, but it is a necessity for the church to disseminate information, and proper information that will demystify, this condition, that to pass across proper education to their, communities is one of the responsibilities of the church. So it is not a matter of saying that we want to, embark on a panic measure, but on a routine basis, churches, wherever they are located, are also supposed to have health programs that will reach out, like community outreaches, where they go to sensitize people from time to time, not only in times of epidemics, but from time to time, talk to them about how they can maintain healthy lifestyles, both for themselves and then in their environment. So it is a normal thing that every church should engage in, so that the communities where they are can feel an impact of what they are doing. That is one. Number two, in terms of talking about compassion, yes, we ought to have compassion. And where this comes in is in taking care of those who are affected and those who are the survivors. The church ought to, give appropriate support in terms of, provision of the needed, resource for doing the test. When they need to do the test, they need to also provide, for where medications need to be provided. Many of the people who are affected might be indigent people, so the church needs to provide support. I mean, at the last synod, which we had in our Oshu diocese, I remember, Professor Lashibiko was asked, he just asked, how many of doctors are here in this synod? And incidentally, I was the only doctor that was at the synod. And then he said, every parish, every church should have a health program. and not just curative health program, but they should also have a preventive health program. In fact, prevention is cheaper and better than cure. So every church should have an arm or a committee, a health committee that is constantly involved in sensitizing the environment. I mean, the community, persons or people in the community, sensitizing them, teaching them, about how to maintain healthy lifestyles, and going the extra mile on providing the resource that is needed, for the indigent people in the community to be able to access, healthcare. I'm talking about health-seeking behavior. The church needs to keep telling people, yes, we believe in faith. Yes, we believe in divine health and healing, but we must also not be ignorant, because the Bible says that my people perish for lack of knowledge. So the church should also, let the people know that whenever you're having this kind of symptoms, please make sure that you seek help at the appropriate. That's go to the hospital to seek help. These are some of the responsibilities of the in this matter. Thank you.
Thank you very much, Dr. Ogini. This is really, really very, very educating. We know we've taken a lot of your time, but then before we end the segment, just one last question for you. I just want to ask, what message of assurance and responsibility would you leave with Nigerians and to our viewers watching from their homes in a time like this? And on a lighter note, should Nigerians actually get prepared to bathe with salt again? A lot of
oh God. Now, if you're bathing with salt, you're going to get dehydrated. So there is nothing. I mean, this is not part of it at all. Nigerians, what I would say to Nigerians is, let us take advantage of this current situation to improve on our environmental hygiene, on our personal hygiene and environmental sanitation. Let us remember our hand washing, which is what I've been taught since I was in primary school. They tell us about personal hygiene. Wash your hands before you eat. Ensure that your nails are kept low. Keep your environments clean and things like that. This is a call for all of us to go back to those rudimentary hygiene that we will now ensure that as individuals, we maintain good hygiene, personal hygiene, and then we engage in environmental sanitation and to ensure that our environments are clean. And then, of course, if we find anyone that has symptoms, even that these are just malaria symptoms, let us have a high, index of suspicion. Let us support such a person to seek help in the hospital, and let us ensure that we ourselves take the necessary precaution of not coming into contact with body fluids or people that are suspected to have, conditions, or people that have some conditions that may be, akin to Ebola disease. I think these are the things that we need to do. I would not support for us to go and start bathing with salt. It doesn't make any sense. Mm-hmm. And then, of course, I would not also encourage us to panic, because there's actually nothing to panic about at the moment. All we need to do is take care of our personal hygiene, ensure that our environments are clean. And then, of course, the Nigeria Center for Disease Control and Prevention is also doing everything to ensure that our borders, surveillance is mounted on our borders, and then they are screening everyone that is coming in for symptoms. I believe if we do all of these things, this virus this time around will not even get to us at all. With our ears, we'll only be hearing, but it will not come to us, because, I want to go spiritual. I say, it says no plague will come near our dwelling place, but with our eyes only we will see, and we see the recompense of the wicked. I believe that this will not be our portion in the mighty name of Jesus.
Amen. Doctor, we are privileged to have you this morning, and we want to appreciate you. You've really schooled us, and of course, I know that understanding has been engendered even among our viewers, and of course, even we in the studio this morning. We want to appreciate you, Dr. Adeniyi. Sir, thank you so much.
Thank you very much.
We
It's my pleasure.
Thank you so much, sir.